we have reached our final presentation from HOSA, Future Health Professionals. Let's introduce Bergen Morrison and Jan Mould. Bergen Morrison is the Director of Competitive Events for HOSA, overseeing the implementation of 84 competitions, over 10,000 participants annually. Her background is in rural healthcare workforce strategies. Jan Mould is the Deputy Director of Competitive Events for HOSA. With 39 years as a registered nurse, 25 years of those years spent in the classroom as a health science instructor. So welcome, both of you. Thank you for being here.
Thank you for the introduction, and thank you for having both Jan and I with you today. We are excited to be sharing with you about using simulation to engage future health professionals. So as the last session of the day, we are really going to try to bring us back to the very beginning, actually, of the health education training pipeline, and hopefully offer a new perspective from a practical application using Body Interact. So we are with an organization called HOSA, Future Health Professionals. We are a career and technical student organization that focuses on preparing our future healthcare workforce. So we're based in the United States. We have been for over 30 years now, but our membership has also expanded internationally. So we now have chapters and members in Canada, China, Korea, Germany, and that number is growing and the locations are growing every year. Pre-COVID, we served over 250,000 members annually. Our membership is a little bit down, but we are starting to approach that again this year. Most of our membership is in the secondary, the high school level students. So ages 14 to 19 is where the majority lies. But we do also have some post-secondary collegiate members. And now we're actually even starting as far down as the middle school age level of students coming into HOSA. So everything in HOSA is student-led. So you can see here on the screen, the top left photo is our International Executive Council. These are elected members who lead the direction of our student-based organization. So if you come to one of our conferences or one of our events, you're not going to see any adults on the stage leading. It is our intent that our focus is on our students. They are focusing on their leadership skills and their communication skills as they prepare to become future health professionals. So we know that we must interest and excite our students at a younger and younger age. They are really starting to make decisions about their future careers a lot earlier in life. And so all of the programming that we do in HOSA is really just about engaging them, exciting them, and showing them all the different opportunities that there are in health and in the healthcare industry. So it's really about that exposure and providing opportunities. So we do not offer any certifications of any kind. We do not offer any degree programs of any kind. We are working curricularly with the school systems and in conjunction with the very introductory level health science classes that our students are taking. So we're that very start of the healthcare pipeline. And we know that for our students, especially at the younger ages, that we know it's really vital to come up with creative and unique ways to engage our young learners. If we don't interest them now here at this entry stage of the pipeline, they're going to go into other fields. And so the conversation has to start a lot earlier. So for us, that is where our relationship with Body Interact comes in.
So during COVID, like everyone else has talked about, we were looking at ways to bring the clinical health care setting to our members. The first year that we had a virtual conference, we had 60 days to make it happen. So we started looking at our students, what they were doing. It was basic clinical skills, vital signs, CPR, first aid. It went up to inserting an NG tube, administering medication, PPE, making a bed. So what we were trying to do was see how we could have a quality experience and enhance the learning of those members while they were still at home. And honestly, it came from a Google search where we were looking at options that we found Body Interact. That was in December of 2020, and our partnership started. When we started looking at the cases in the Body Interact library, they were a little bit too advanced for our predominantly high school members in terms of coming up with diagnosis and knowing how to handle treatment and medication options. But there were a few that we felt like were promising in the nursing and the EMS scenario options. Once we saw the Body Interact demo, we knew that Body Interact technology and the platform of simulation as a whole was going to be so exciting to our members. We know with students, anytime they can get their hands onto something to touch, feel, see, and do it themselves, that it's far better than a classroom lecture or an article that we could give them to read. So for our summer 2021 conference, where we had nearly 9,000 attend virtually, we worked with Body Interact and they came up with the virtual patient challenge for our members. Body Interact came up with new cases to align to that introductory level that Bergen talked about for our high school students. And the virtual patient challenge, in the first round, the teams were given a virtual case. They had 24 hours to log into Body Interact and run through the case together as a team. Then the top teams advanced to the live rounds on Zoom, where they were given another case, logged in remotely to Body Interact, and worked together to diagnose the patient. The winning teams worked their way through the bracket, and ultimately the top team emerged and was recognized as part of our international awards session, where we give medals to members for various health-related competitions. We also had the debriefing session that was discussed with the Body Interact physician, who went over the scenario with the students and provided context for what they had just experienced. Since our international conference last summer, Body Interact has partnered with 5 of our state associations to host these patient challenges. They've worked with Alabama, California, Pennsylvania, Idaho, Texas, and Canada. Some this year were virtual again, but most were in-person virtual patient challenges. But as always, the students can say it much better than we can. So we wanted to share a short video clip from the California HOSA students.
Hello, we're students from Crescenta Valley High School, and we're here at the 2021-2022 Cal HOSA State Fair. One of the amazing workshops we went to, and one of them I found super interesting, was Body Interact.
It was very enriching. We were able to understand how to actually go and talk to patients and understand that even though we have a correct diagnosis, it is important for us to confirm with the patients and have appropriate treatments in mind.
It's a very nice experience. The program is very interactive and it allows you to use different tests to determine what condition the patient is suffering or what medication you might need to administer.
It's a very helpful experience having a virtual patient instead of a real one.
It helps people build confidence to be able to take on the challenge in a real.
And it's great helping our problem solving skills.
There's different levels of beginning, intermediate, and advanced, so you can continue to practice and go through multiple sessions and really analyze different scenarios.
You can also collaborate with your group to find out what the best diagnosis for them is.
Virtual patient was lifelike, and the entire thing was really entertaining and we learned a lot from it.
I really like Body Interact because of how realistic it was.
We learned to be better healthcare professionals in the future and helped us expand that, not just the academic side of healthcare, but more of the social and emotional sides behind it as well.
We did 3 virtual simulations over again in the past 2 days because we found it so fun, and we would like to invite almost anyone to come try this because we think this is the most interactive workshop here at Cal HOSA.
So moving forward, Body Interact has really done an excellent job over the past 15 months, I'd say, to add educational options that are really targeted to the high school level and the CTE, or the career and technical education level. There's more emergency services, the trauma, intro to nursing, and very intro to medical pathways, respiratory, and also a lot of first aid type of cases that have been added into the library. So these cases really fit perfectly for our members at our age level. The simulation, of course, promotes critical thinking, the problem solving, teamwork, communication skills, all of those things that we really stress and focus on in HOSA, and which are the foundation for any healthcare career that our members are going to enter. At the same time, they're really able to use some of that basic medical terminology, anatomy and physiology, interpret basic vital signs. So some of those things that they are starting to learn in those pre-health professions courses right now. And of course, it's fun. You saw the excitement in the video. The students are excited about what they're doing with virtual patient simulation with Body Interact. So we really feel like in our partnership with HOSA and Body Interact, we found these creative ways where we're not only introducing this tool to our teachers who are in the classroom day to day for their instruction, their curriculum needs, but from our larger organizational perspective, we were able to use these patient challenges as another tool in our toolbox to just really engage and excite our future health professionals. And we really believe, and we know that if we can expose students to this simulation at this early age, even at this very intro high school level, the more prepared that they're going to be as they enter any health professions training program in the future. You know, just think if you had nursing students or medical students or physical therapy students coming into your programs who had already been exposed to this quality of simulation like this, you know, years before at a level that was appropriate for where they were at in their educational journey, it's going to strengthen the entire healthcare pipeline. So we really feel thankful that Body Interact has joined what we're doing in HOSA to promote that introduction and excitement from the beginning of the healthcare pipeline. So thank you so much for having us today and for the time, and to all of the speakers and participants on today's session.